critical resource to track water accessibility and pinpoint which households it's affecting the most. From the latest report, it's crystal clear that low-income households are being impacted the most. Many are unable to pay their bills, which then affects their living situation and their health. I still tell the story of when the pandemic began, and public health officials were telling people the most important thing that they could do was wash their hands regularly. And water was being cut off in the city of Detroit to so many families and across the country. I was aware of it because that's my home. Additionally, it's really clear that the current law doesn't reflect the needs of low-income households and their right to water access. I think water is a human right. No one, regardless of their race, their zip code, or income, should be left without access to safe and affordable drinking water. There continues to be a growing strain on working families to cover the cost of water bills for too long. Just saw an increase again yesterday, and the pandemic has only exacerbated this problem. We need to have strong federal policy that ensures that everyone's got access to water. That's why I've introduced legislation to address the water debt crisis and legislation to establish a permanent residential emergency relief program for public water systems, as well as urging a federal response to water shutoffs during the pandemic last year. If someone cannot afford their water bill, federal and local governments should work together to help them, not punish them or their families by cutting off their access to water. And if we're talking about access to water, we should also be talking about clean water. We need to work to invest in replacing contaminated lead service lines, eliminating lead in our schools, and helping low-income communities ensure water is accessible, we get the lead out of the pipes, and that it's affordable. Just my district, which actually doesn't have any of Detroit or many other of the communities you've heard about in Michigan, there's a minimum of 10,000 existing lead service lines with another 11,000 that are likely, that have lead in them. My home state of Michigan has been suffering. Flint really made people understand what was happening to people who were drinking water with lead. But now we're seeing it in Benton Harbor again, in communities across this state. There's still millions of people across the country that don't even know they are drinking lead. Parents in Benton Harbor have just broken down in my arms crying, which they did in Flint several years ago. They keep saying, you've got to do something. And they're right. I thought we were doing something after Flint. No amount of lead in drinking water is safe. This is an opportunity to make a difference in children's lives and to replace lead pipes and service lines across the country, including schools. And that's why I am proud that the bipartisan infrastructure law includes millions of dollars for replacing lead service lines and cleaning up our water from forever chemicals, PFAS being one of them, and lead. What we did in the bipartisan infrastructure bill will be the single largest investment in water that the federal government's ever made. My home state of Michigan is set to receive $1.3 billion to improve water infrastructure, including the lead service line replacement, and to ensure that safe drinking water is available in every community. And I'm not going to stop fighting until all those dollars are used to replace lead pipes in Michigan, and we get that extra 3.5, which was in the Build Back Better bill, to get it out of every line. And not just Michigan, but across the country. And I won't stop fighting until everybody in this country has access to clean water. The lives of our neighbors, our children, our families, our country depend on it. It's that simple. So thank you to the Center for Water Security and Cooperation for all your work and the efforts to truly make water a human right and to fight for access for everyone. We all have to work together across all sectors to fix this issue that's affecting so many families across the country. Clean water should be accessible and affordable for every single person in this country. Thank you.
Thank you so much for those remarks, Congresswoman Dingell. I couldn't have said it better myself. So thank you for saying that. And it's just an honor to have you here and to be able to bring those stories from Michigan straight to this discussion, because it's those kinds of stories that bring to light that there are real people being hurt by this lack of access to water, that there are real people that are drinking contaminated water, that don't have access to water, that are losing access to water because of shutoffs. There are real people behind all of this data and information and behind all these news stories. There are real people. And I appreciate you being able to bring that to the forefront, because I think that's easy to forget. And especially in a world where we're facing multiple different threats, multiple different issues on a daily basis, water doesn't seem to make it to the top sometimes. And yet this is a daily struggle for a number of households. And it's something that we cannot forget. Even if other people forget it, we can't forget that we're fighting for those families and fighting for everyone to have access to the resource that everybody needs in order to survive and to live. So thank you for highlighting that in those stories. And with that, we're going to move forward to launching officially the American Water Access Survey. So let me spotlight. Sorry, just some technical, let's see, spotlight. Right. Share my screen. I have a quick presentation. Hopefully with that, I should be able to share that as well. All right. Sorry, for my age and generation, I should be much more technologically savvy. Quite frankly, I'm not. So it always takes me a few minutes to get everything set up. So thank you for your patience. And quickly, just to introduce myself, my name is Alexandra Campbell Ferrari. I'm the Executive Director of the Center for Water Security and Cooperation, and I'm absolutely delighted to have you here today. This is a really, really special moment for us, and it's been a long time coming. So we're delighted that you can join us for the launch of the American Water Access Survey. And as Luke said earlier, the objective of the American Water Access Survey is to ensure that households get, have, and keep access to water. So get, have, and keep access to water. That will be the theme for today. In terms of what I will be discussing, I will be discussing how and where this all got started. I'll be framing the issue in terms of discussing a little bit about how access to water is actually defined and how we've defined it in order to create that target and that goal that everyone needs to be working to achieve. And then also I'll be discussing how we've gone about creating the American Water Access Survey and how we'll be using that moving forward. So this journey started several years ago. It actually started in 2017 when we issued our first report highlighting the impact of law on access to water. And it was actually a conscious choice to actually use the word accessibility and access instead of affordability, which is most often the term that is used when discussing these issues. So at that point, we didn't quite have a clear idea as to how we were defining access and that this was going to be the guiding theme moving forward, but we knew that the concept of access was bigger than just the idea of affordability. So we launched this in 2017, and it was really the first report to examine how the local level laws impact access to water, particularly low-income households' access to water, and the consequences of late and non-payment of water and wastewater bills. Actually, until this point, there had never been a comprehensive examination of local level laws, and it's where it's at the local level. It's with those local level laws that access to water is determined. So in that report, we looked at 20 23 counties and 157 municipalities laws. And ultimately what we found is that there are very few protections for low-income households and very few protections to ensure that every household gets, has, and keeps access to water. So from that, some high-level conclusions were is that, look, we've got to define the word access. If this is what we're aiming for, if we're trying to make sure that people have access to water and access to sanitation, then we need to know what that means. We need to have a way, a compass, a measure of success, a way to say, okay, we have actually achieved this, or no, we haven't achieved it. We need to have that compass. Second, what we realized is like, look, the law is just not doing a good job here. The law is that foundation. And that foundation was shaky at best for ensuring that households, particularly low-income household families, could maintain access to water. And second, and third, the law is at the heart of that change because we make the law. We determine what rules govern the decisions that we're making, and we can change that. We can't change scientific facts and principles and realities, right? Water can be contaminated. We can't change that. However, what we can change are the rules that are governing certain decision-making and certain actions that are being taken. So it was with this that we started developing the American Water Access Survey. So the very first thing that we had to do was start with an actual definition, right? So we defined access to water as having in-home, reliable availability of sufficient water to meet domestic needs safely. And if you're sitting there wondering to yourself, that's just a lot of words, we thought the same thing, but it's a starting point. But we knew that there were a lot of different factors in that, right? So we have in-home, we have reliable, we have availability, we have sufficient, we have domestic needs, and we have safety. So there's a lot of words that all go into ensuring that there is in fact access to water. And that was a big part of it. We knew we needed to frame this in a broad way because if we left anything out, then our access to water could still be under threat. And we wanted to have a comprehensive method by which and target metric by which to say, okay, we can safely say, or we can conclusively say, yes, our access to water is guaranteed or our access to water is under threat. And so that led us to developing more in depth what that concept means. So we took that definition and we realized, well, there's really two components to this, right? There's a physical aspect and there's this economic access component, this financial component. And so we broke it up into physical access and economic access. And physical access is represented by having three things. So sufficient source water, so rivers, lakes, streams, aquifers, where our groundwater comes from, having sufficient source waters that are available to meet current and projected demand for domestic water use, right? So we have to think about today and tomorrow. Second is the infrastructure. So ultimately the way that this water gets to our house is through infrastructure. And so we need to have some kind of infrastructure that can deliver the water from that lake or aquifer to our home where we live. And then third, we need good quality water service that protects human health. And this is what Congresswoman Dingell was largely speaking to. If your water makes you sick, if it's unsafe to use, if it can give you a rash, that is not having access to water. And something that feeds into that is dirty rivers, dirty aquifers, contaminated aquifers. So the dirtier our water resources, the dirtier the source water is, the greater challenges we'll face in ensuring access to water. And then the second component is economic access. So economic access is what we focused on in our Maryland report and will be focusing on and have focused on during the first iteration of the AWAS. And economic access is that ability to have access to water and wastewater services despite an inability to pay. So if I'm a low-income household who is struggling to pay, I don't have sufficient financial resources to pay, the idea is I should still be able to maintain access to water despite my inability to be able to pay. That's critical to achieving economic access. And then equity is governing all of this. Because if one of us does not have access to water based on whatever characteristic, then we're failing. We need equitable access to water, and equity is guiding much, if not all of the thoughts and all of the conceptualization that we have developed here for defining access to water. So this was published back in April of 2021, and this was really even more so the launching point for the American Water Access Survey, or the AWAS, as you might have heard me refer to it. So that was the foundation, and with that foundation, we could start to identify the indicators and the factors that would set the standard for what it means to have access to water, as well as to allow us to track over time whether or not a household is at risk of losing access to water. So that's critical. The AWAS is both a standard, it sets that standard, as well as it also serves as a benchmark, a metric, a tracker for watching over time and being able to proactively say, oh, we have a community that's at risk, or no, we don't, we're actually making a lot of gains here. So that's important. Those are the two kind of important purposes of the survey. So based on the definition that I just talked about, right, there's the physical access and economic access. As a starting point, we've started our first iteration, first edition of the AWAS focuses on economic access. So we needed to take off a smaller chunk just to get our teeth into this. And as you'll hear me talk about, there's two kinds of indicators that we focused on. One is law as practiced, and one is law as written. So when you're thinking about law as written, it's what are the words on the page? What does the law actually say? Who has to do what? What are the rules, right? If you're playing a board game, right, the first thing you look to are the rules. Who can do what? What kind of actions can I take? So it's exactly like that. And then we also look to, well, how exactly is a law practiced? How do people act based on that foundation that is created based on the law? So those are the kinds of indicators that we developed and form part of the AWAS. So I'm already starting to talk a lot about law, and you may be asking yourself, well, when I think about water, I think a lot more about infrastructure. I think about water resources, or I think about other things. I don't necessarily think about law, right? Law is a word on a page. It's several words on a page. So why does it matter? So the diagram here, I think, helps to visualize why law is such a critical linchpin for this survey. So if I've received let's imagine I'm a low-income household and I've received a water bill, and I that month don't have sufficient financial resources to pay the bill, there's two things that can happen. I can have my water shut off, or I won't have my water shut off. And the law is what decides that. There's nothing else that decides that. The law is what gives a utility the authority to shut off water, or the law creates certain protections. It may specifically call out that there must be certain protections in place for low-income households. There are many things that law can do, but the law is that deciding point between a family maintaining access to water when they can't pay, or not maintaining access when they can't pay. So that's a critical visual there. So this is the survey itself. And this is just a taste of the survey. It will be published tomorrow. And so you'll be able to get a full view of what it looks like. But this is how we've developed the survey. And what you can see is the indicators and drinking water and wastewater. So DW is drinking water, wastewater is WW. And I'm focusing a lot of the conversation today on drinking water, but just so that you know, for wastewater, oftentimes you can't use, for most people who are on a network service, you can't use your toilet without water. If you've had your water shut off for any number of reasons, you'll know that your toilet becomes non-functionable without water. So that's why wastewater is actually a critical part of this conversation as well, even though a lot of the conversation is focused on drinking water. So what you can see is we created a color coding system, and the color coding system is red, orange, and green. Red are those laws that we might see that are not good. They create the fewest protections for households with respect to economic access. So for example, water shutoffs are permitted or forbidden for non-payment. That's the indicator. That is what we would expect to see, specifically with respect to low-income households. And here, you can see that where it says water shutoff allowed and there's no income-based restrictions, that's red. Where a utility or where a law would say, just give a utility a blanket permission to shut off water services without any consideration of income, that's marked red, and that would be indicated in the survey. If it's silent, if it doesn't say either way, whether or not the utility can shut off services, that would be considered red. Green, on the opposite end of that spectrum, means that a water shutoff is prohibited with respect to low-income households. So a utility under the law would not be allowed or permitted to shut off water services to a low-income household when they cannot pay. So that's a taste of what the survey will look like. And you'll see its application in just a few moments. Another example, and this is, I think, a little bit of an interesting one, for disconnection fees, right? So we expect that the law would actually set forth a limit on a disconnection fee. Otherwise, those disconnection fees become penalties. They become poverty penalties, essentially. And so as applied to low-income households. And so here we have, okay, well, green is where it is tied to the specific cost for disconnecting a service. Staff time, truck time, whatever the actual cost of disconnecting a service, that's fine to have noted. On the opposite side of the spectrum, if it's an arbitrary number or there is nothing stated, that is a worse option, right? Where the law doesn't actually set a limit on what that disconnection notice can be. It could be upwards of $500, where the law doesn't actually state, hey, this is the limit, where a cap we're placing on the disconnection fee. So those are just some of the examples of the indicators or criteria we have adopted for the AWAS, as well as the metric and value that we're associating with them. For law and practice, we've done the same thing. So this is, what are the kinds of actions that we're seeing being taken on the ground? So the law may, so for example, the law may say, yes, a utility can shut off water services. They have a blanket authority to do that. However, maybe you look at the utility and they aren't actually shutting off services. And so they get a green. They say, they've made the determination that shutoffs against low-income households is not within their mission. And so we would mark that as green. Other things you can also see. So whether or not rate assistance is being offered. So we would expect either rate assistance or a payment plan to be offered by utilities. So you can see here that rate assistance is available to customers who cannot pay, or payment plans are available to customers who cannot pay, and they get different color markers. And the reason being is that if I offer a payment plan, as a low-income household, I still have to come up with that money, which is going to be a pretty hefty challenge. If I receive rate assistance, that helps to defray some of the costs. It takes some of the burden off of me and makes it more likely that I will actually be able to pay my water and wastewater bills. And then again, just since we talked about disconnection fees earlier, I'll just note here that where we've noted whether or not the disconnection fee is pegged to the cost or not pegged to the cost, and whether it's forgivable, right? A utility could have the authority to charge a disconnection fee, but ultimately forgive that fee once the low-income household pays. So then the low-income household would not be subject to paying that bill or that fee. So this gives you a taste as to the different kinds of, like I said, indicators and criteria and the metric that we're using to measure access to water, specifically in the context of economic access. So with the survey officially launched, we also actually went out and applied this to 6 cities. So we worked with constituents in 6 different cities across the United States for the first edition of the American Water Access Survey. So we worked in Cleveland, Ohio, in Detroit, Michigan, in El Paso, Texas, in Richmond, Virginia, in Shreveport, Louisiana, and in St. Louis, Missouri. These were the 6 cities. And they were selected based on 3 criteria predominantly. One was the percentage of the community living under the federal poverty line, the percentage of community with Black, African American, or Hispanic, Latino, Latina, Latinx residents, and as well as a population size between 100,000 and 750,000 residents. So we wanted kind of smaller to medium-sized cities with a diverse population. That was critical for us, in large part to really raise up the fact that in many of these communities where there is a predominant minority community that has experienced historic and systemic racism or discrimination, we want to understand better how the laws are feeding into that. And particularly because we know that the laws are feeding into that. So we prioritize these communities and made that a central part of the methodology for identifying which cities to first conduct this in. So for each city, we worked with each utility to complete a survey. So the utilities responded to a series of questions that we had. And then we also collaborated quite closely with locally based community action agencies and nonprofits, which many of whom you'll hear from today, to reach the actual households through our household survey. So they were instrumental in allowing us to get through to the households. So what did that look like? So I include this a little bit for dramatic effect. I was surprised with how red this wound up being. And this is the law alone. This is essentially a statement that in large part, the law in many respects actually doesn't speak to most of this. So you'll notice throughout, and I would say probably 85% of the boxes say not stated. There's nothing in the law that says anything about an interest fee or a late fee or a disconnection fee. It may or may not give, most likely it says nothing about whether or not a utility can charge those. In some instances, the law does say something. So with respect to shutoff notices, there are some specific requirements that a notice is required before a shutoff. But in 3 cities, there actually is no requirement under the law that a household be notified before their water is shut off. So there's a lot to pick through here. But I really show this to say there's a lot of work that we have to do. The law is woefully underrepresenting the challenges and protections that we need to have in place in order to protect families' access to water. Now, the good thing is that when we start to look at the law and how it's practiced, we see a little bit more green. So I will highlight that, for example, Cleveland is one of the only communities that we worked in where they actually don't charge any late fees, any disconnection fees, any reconnection fees, or any interest charges for late or non for late payments or payments that are never made. You'll see that in 5 of the 6 cities, rate assistance is in fact offered. If it's not offered by the city or by the utility itself, it's offered by a partnership or an organization with whom the utility has partnered. In St. Louis, they offer payment plans. So again, that's an orange color, but at least they offer a payment plan. And if you look at the reconnection terms, again, this was a critical part to trying to understand, okay, if a family were to lose access to water, what would happen? So you'll see for reconnection terms, for example, that past due bills have to be paid in full oftentimes, or a payment plan can be established. So the reason that many of these boxes are orange and not red is because the household that has experienced the water shutoff can, in fact, enter into a payment plan. And they don't just have to be able to pay all of their past due bills in full. One more thing that I will highlight is that one of the critical aspects to this issue is that we don't know. There's a lot of things that we don't know, and there are a lot of data and information that's very, very challenging to find. And so we would expect that utilities be sharing information about water shutoffs. One of the things we found is that the number of water shutoffs is not published on any utility website. So we really don't know the scope of the challenge unless you reach out and talk to the utility directly. So this gives you a similar sense that there's a lot of work that still needs to be done and a lot of opportunity through the application of this survey. So I've already touched on many of these conclusions, but I'll draw attention to a few of them. First is that all 6 utilities under the law are allowed to and do actually shut off water services to low-income households. All utilities charge at least 1 fee, or 5 of the 6 utilities charge at least 1 fee for late and non-payments. 3 utilities submit unpaid water bills to be converted into liens, and those liens can ultimately be foreclosed on. So that's something that's important to keep in mind as well. And the last thing that I'll highlight, and it's a little bit different from what I've been talking about, but ring fencing of fees. One of the things that feeds into this challenge is that there has to be revenue to support the fact that there are families who can't pay their water and wastewater bills. And so one of the things that we often looked at in partnership with these ideas is whether or not all the revenue that is generated by customers paying their bills has to be ring fenced or has to be directly reinvested back into the utility. And what we find is that only one city's laws actually directly requires that. So there's only one city that actually requires the revenue from customers to be reinvested into the utility. That's a critical thing to think about. that if the money can go to other things, if the money can go to other city priorities, then there may be a reason why rate assistance programs are not being funded. As I mentioned, one of the things that we spent a lot of time on was partnering with community action agencies and nonprofits to hear the voice of households. And these voices are really important. As I said earlier, and I think one of the things, and I appreciate Congresswoman Dingell bringing that in, are the stories. You know, behind all of this, you know, we're talking about numbers, we're talking about words, we're talking about laws. This is the impact. There's really no better way to understand the impact than to look at these quotes and say there is a very real impact on a human life at the end of this. So someone is losing access to water. Someone cannot feed or clean their children. Someone cannot, they can't sleep. They can't think, they can't eat. They're consumed by the threat of either an impending shutoff or by the fact that their water has been shut off. And now they have to go and find an alternative source of water resources. So I put this here because this is what we're fighting for. This is why it is so important not to forget about access to water, and in fact, to prioritize it. And I included the last quote because these households are real people and we need to talk to them more. And one of the things that we realize is that households were not being talked to. And you need to reach out to them. You need to talk to them. You need to better understand the challenges that they're facing, because the way that we develop and craft our laws, the way that we craft a response to these challenges has to be in line with what they need, in line with what they need to survive and to thrive in their community. So some of the recommendations we have, and I'm just going to touch on these, is that one of the things is we have to know what communities are facing. There is no tracking of this. This is the first survey of its kind to actually track this data and determine whether or not households are at risk or not. But we have to know that. We have to bring this out of the shadows and shine a light on it in order for people to know that there is a problem and it is having a tremendous impact on very real people. We know that state and local law has to prohibit water shutoffs against low-income households. At the end of the day, every single human needs drinking water. It isn't a choice. Every single human being needs drinking water. It is critical, it is necessary to human existence, and we can't forget that. Any of those fees that are charged against low-income households, anything that makes it harder to keep access to water needs to be gotten rid of. And lastly, we need greater transparency. We need this issue to be held up. We need this issue to be highlighted so that we can take action and protect those households' access to water. So I'm setting forth a few of our next steps, of which we hope that you'll join us on them. This is a journey. And like I said, this is a journey that started in 2017. And so our first line of business is to work with these 6 communities, with the communities, with the utilities, with the legislatures, to discuss and act on these results. As we promised the households, we weren't just asking for these data points as a research project. We were asking for their input. We were asking for the input from the utilities to take action, to bring about a real change and ensure that households and communities' access to water is not under threat. The second thing we'll be doing is actually finishing the development of the American Water Access Survey. So Luke mentioned that this is a much broader survey. When I talked about physical access, this covers water resource management, water quality, drinking water quality, actual infrastructure quality. There's a lot of different components to this. And so it's our job to actually develop and finish and complete the development of the survey. So we have formed a Water Access Alliance, of which you can join. If you're interested in partnering with us to develop this survey out, please, in our report that we'll be publishing, there will be a form that you can fill out. And you can indicate your interest and indicate which of those different indicators, the physical access or the economic access that you're interested in getting in working with us. And then lastly, we're going to be working with more communities. So how can you help us? You can nominate your community. You can partner with us to collect the data and information, and you can partner with us to take action. This is not a single person journey. This is a worldwide journey, but it is a community journey. And we need your help and support in making this a success and in actually ensuring that households get, keep, and have access to water. So with that, thank you. And we'll be transitioning to the next panel, or to our first panel.
Thank you very much. Yes, thank you, Alexandra. That was a very, thank you for that presentation. It's always moving. I was saying it's always moving to hear all of the stories, not just the ones that we heard from the survey and the responses that we received from the survey, but also the stories that we heard from Congresswoman Dingell earlier. Families struggling with this, breaking down. It really is such a necessary thing, water, and it's important to think about how we protect it through the law. It's something that is often not on our radar, and it's important to make sure that we keep it at the forefront, particularly for those who aren't gaining access. But it is a conversation, and it is a conversation. It's something. It's something that communities need to work with utilities, and it needs to be. We need to make sure that while we're providing this access, that we're also ensuring that utilities are well prepared and have the resources to provide that access. And I know part of the report that Alexandra mentioned was focusing on that ring fencing, ensuring that the money is there to provide that support, to provide that assistance. But it's actually a very good lead-in to our first panel of this afternoon, where we will be talking with some people who are more familiar with the utility side and getting a sense as to what some of the difficulties are from the utility side to preserving this access. So we have two panelists who I'm going to highlight. Michelle Daston Van Rijn, who is a senior advisor to the U.S. Water Partnership, and Director William Daniel from the Shreveport Water and Sewerage Department. And I don't see Mr. Daniel. Just check to make sure. I don't see Mr. Daniel. So what I will do is I will start the conversation with Ms. Daston Van Rijn, and we'll see if we can locate Mr. Daniel in the interim. So yes, so Michelle, it's wonderful to have you with us today. And I know you've been working on some of these issues. And I guess one of the first questions that I would like to pose to you is, when you have these shutoffs, they're very often a very blunt instrument. It's when you don't pay your bill, your water is shut off. There's not a lot of wiggle room in that. It's on or off. It's a flip of a switch. Alternatively, we have seen some communities who have also been engaging in water shutoff moratoriums, which in many ways is also a switch flip at the same time. It's on the one hand, you have shutoffs. On the other hand, you have moratoriums against shutoffs, which then also can be somewhat detrimental, particularly to utilities who are struggling with getting people to pay their bills. So can you speak a little bit to what some of the concerns might be for a utility if shutoffs were ended completely? I'll turn it over to you.
Thanks. First of all, thank you very much for inviting me. I was really hoping that you were going to actually hear from those who are actually working within utilities. But I certainly can answer the question. I work with the U.S. Water Partnership, which brings together over 125 different public, private, academic and civil service institutions that are dealing with water security. And we specifically have been working to bring organizations, utilities from Southeast Asia and from the United States together to discuss some of the issues, including things like what do you do if you're in a situation where people can't pay, et cetera. In this particular situation where you're talking about whether there is a moratorium and it's either there or it's not, one of the big questions obviously is, will that create perverse incentives, right? It depends on how that's created. What does the moratorium mean, right? If everyone knows that their water isn't going to be shut off, does that mean that others will then in fact not pay their bills because they don't have to worry about it? And so the way to potentially deal with that is to be very much more focused on bringing the community together, understanding what is at stake, making it clear that the utilities are there to serve themselves and everyone else from the community, and to make sure everyone feels like they have some part in that, in order to make sure that everyone can have access to clean, safe, reliable water. So if it's just a pure out moratorium, some of the things in the structures that might exist at the utilities, as far as rate payments and things like that, rate payments, you might have to rejigger that, and you may have to be spending a lot more time on education and transparency.
Great. Yeah, so I guess one of the follow-ups that I would have to that, you mentioned that you've been bringing a lot of utilities from Southeast Asia. Is part of their business structure that you've been seeing as common, does it include water shutoffs in these other communities in Southeast Asia as well? Is that a similarity that you've seen?
They certainly have had to do this. They have had to address these types of questions as well. I don't think they're as quick to go down the path of, well, they are on the path of not shutting people down, but they also have a lot more people that don't have access at all. And so there's a question of how to actually get them into the system. One of the things that AWAS is basically focused on, as far as I can see, and what I did when I was reading, was really talking about those that are already connected to the urban or rural water supply, right? So some of the issues abroad in Southeast Asia, or how to actually get people to be connected and to remove fees for actually getting people connected to the water. So I think they're focusing even more on that than the moratoriums on those that are already connected to the water service.
Well, that's actually a really good point to raise as well, because I mean, one of the things that shutoffs in some ways do is they increase that payment. You know, shutoffs allow utilities to ensure that the revenue stream continues and that unpaid bills don't become, well, first of all, larger and larger for those individuals to the point where they can't be repaid, but also to make sure that the utility doesn't end up bearing a lot of customer debt at the same time. So in the work that you've done, have you seen different ways of funding these utilities, of developing that financial security for utilities so that they don't necessarily need to use shutoffs? Are there obviously there are most likely common issues in terms of funding utilities, but you know, how have these utilities tried to create rates, or try to, instead of using rates potentially where you're charging by a certain amount, a certain volume of water, have there been other ways that they've explored to get that revenue, to increase revenue, or to get that revenue in the first place?
Well, what's interesting is actually, I think you switched it around, right? Because it was a question on the moratorium on shutoffs, right? Versus being able to shut off. But in some places, the situation is such that they, for example, in Johor Bahru, Malaysia, they don't have it in their own power to change rates, right? So one of the questions is, what sort of governance structure do you have? Are you able to change rates based on your situation, and how are you using those rates? Are you using those rates to set to provide an economic incentive to use less or more, et cetera, and to provide either carrots or sticks for those that are in fact using the water economically? Or and you can see, for example, I think it's like Shreveport has like a tiered system, right? So that tier 1, where you're using the least amount of water, the costs have not changed at all over the years. They've kept that pretty much even, because of the issue probably of the ability to pay. And if you are parsimonious with your use of water, then your prices aren't going to be going up. But those who are less parsimonious with the use of their water will wind up being charged as such in order to, and what's important is educating the community, like I said, as to how they can reduce their water use. One of the things that we've talked to several of our Southeast Asian partners with is non-revenue water, which is of course extremely important when you're talking about keeping water costs down, and as a matter of fact, also for the ecological reasons of not wasting the water resources that might be there. So identifying how to reduce the non-revenue water, that's an important issue in both in the United States and in Southeast Asia, obviously.
Great, thank you, Michelle. And I've noticed that Director Daniel has joined us, just to reintroduce him, it's Director William Daniel of the Shreveport Water and Sewage Department. Shreveport being one of the cities that we looked at as part of the survey. So thank you, Director Daniel, for joining us. And I want to start off with the first question that I posed to Michelle, which was focused on sort of shutoffs versus moratoriums on shutoffs. And sort of thinking about, so shutoffs can sometimes be seen as a blunt instrument. You're trying, it's a collection mechanism. It's also trying to make sure that debt for an individual household doesn't get out of hand. So shutoffs are sometimes seen as a little bit of a blunt instrument, but some of the responses have been moratoriums to those shutoffs, which are also somewhat of a blunt instrument. Moratoriums that prevent shutoffs in all cases. So when you do have these shutoffs or when you have these moratoriums, what are concerns that utilities face? What are the questions that they have? What are the concerns that they have when these types of programs are initiated?
Well, when you have a moratorium on shutoffs and you have a customer with an inability to pay a bill, all that bill does is grow and grow and grow, so that it pretty soon becomes unmanageable. What we have tried to do is have workouts with our customers. We ask them to pay a little bit each month, even if they can't pay their whole bill. We have a program where we work with some nonprofits where they, under certain circumstances, the customer can come in and apply for a grant to help pay their bill, and the nonprofit will pay a substantial part of the bill, not all of it, and then try to put the customer back on a payment plan. We would much prefer to work with the customer and have some sort of payment plan rather than cut the water off. That's just not a good, really, that's not the best tool that you have for dealing with people who can't pay their bill, because that's really not going to change. So working with them, I will say that the biggest problem is in terms of out of control water bills is there's been so much deferred maintenance. I mean, everywhere that I've ever been for 60, 80 years, they just have not invested in their water or sewer system, so that now when the federal government comes in and they ask you to fix it all in 10 years, well, it falls on the back of a lot of people who really had nothing to do with the problem. And then you have to pay for it over a very short time period. So we've raised our rates, and that's putting a lot of people in jeopardy of not being able to pay their water bill.
That actually gets to one of the other questions that I posed to Michelle, which is in terms of collecting revenue. Are you aware, or have you thought in Shreveport about changing from a rate-based structure to a different structure? And I'll put it to you, I don't know what structure might work, or if there's even anything out there, but have there been, maybe moving away from rates and trying a different approach to funding the, water utilities, making sure that the money is there so that maintenance isn't deferred? So have there been other thoughts about how to fund the utility and fund the water service?
Well, there have not been any substantive discussions in Shreveport about it. I certainly believe that there are more equitable ways to finance a lot of these big public works projects that needs to be done. I don't believe that water rates are the most equitable by any stretch of the imagination. I would prefer some sort of ad valorem tax so that people who can afford to pay a little bit will, they'll share a slightly larger percentage of the burden. But this is Louisiana, and we do not like property taxes. We prefer sales taxes, which they are also incredibly discriminatory as well. So it's just it's a dilemma for the city of Shreveport on how to best navigate through these regulatory regimes, and they're increasing. I mean, we're under a consent decree for our sewer. We were really radically affected by the December storm, maybe not so much as other cities, but we lost water here for 7 days. We didn't have water to hospitals, to nursing homes, to dialysis centers, and it took us 7 days to get it back. Being able, then there's the lead and copper rules that are coming out. So we've got this changing regulatory environment, and the only thing that's and what's basically changing about it, it's becoming more expensive to operate. And the only tool that we seem to have at our disposal is raising fees and raising rates. And we're about as, I told this to somebody yesterday, I can't in good conscience go to anybody and say we should raise our rates. I just think that would be morally reprehensible at where our rates are today.
Well, that actually, I think, leads into another question that I have, which is the federal government in particular has been trying to step up some of the efforts on providing money to assist utilities, but also to assist households, either with rate payment or with some of the replacement of lead service lines. And some of those things were spoken to by Congresswoman Dingell earlier, but there's in particular the LIHWAP program, the Low Income Household Water Assistance Program that is being run through HHS, the Department of Health and Human Services, focused on helping to clear arrearages. And then there's also a pilot program was passed as part of the infrastructure bill, but it was not funded, an EPA pilot program to help rate assistance and provide rate assistance. The pilot is for 40 cities. And so the question that I would ask you, Director Daniel, first is, are those kinds of federal programs, either money that is coming through the LIHWAP program or even this potential low-income rate assistance program through EPA, are these the kinds of things that can help to alleviate some of the issues that you're facing, and some of this rate, this ceiling, I think maybe it feels like, on rates, or is this likely to cause different problems? Or, what is your opinion on that sort of federal leadership in those areas?
Well, I would certainly welcome rate assistance for our citizens. There's no question that, I mean, given everything that's happened over the last several years, that they need the rate assistance to pay their bills. But that's kind of attacking the symptoms of the problem rather than the actual problem itself. While that help is certainly welcome and needed, what we need is money for infrastructure so that we can bring rates back down to an affordable monthly cost to that doesn't make them choose between a utility bill and food for their children or their medicine or whatever it is that their need, what other necessary things that they need to buy. It's just we've got to improve the infrastructure of this country, and there's no way to do it other than absent some completely new technology coming along. Sorry about that. I don't know how we're going to do it without fixing our infrastructure.
Right. And Michelle, I want to put the question to you as well. In terms of having a more sort of federal leadership or really working on these issues at the local level, are there any lessons that you've seen in terms of what's been most effective in the U.S. Water Partnerships work? So federal versus local, or sort of the central government versus a much more local government approach to helping to fund some of these infrastructure or potentially rate issues.
Well, sometimes it's the federal level might be the only one that can actually help in certain areas. What we've seen also there, as what Director Daniel had brought up, is being able to figure out how to get financing in order to do the infrastructure that's necessary. One of our partner organizations, Water Finance Exchange, is looking at just that, as far as trying to help with pre-development funding and things like that, in order to actually get some of these investments, and sometimes in the smaller areas, smaller cities, and that's not something that can be done at the federal level. At the same time, what's also important, if you have these types of things that are developed at the federal level, you want it to get to the right people. And I think that's sometimes a problem, and that we've seen in other circumstances. Is it clearly, is it really accessible to those who actually need to receive this assistance, right? I know, for example, my father, he doesn't use computers, he doesn't have a smartphone, and so if he didn't know how to pay his bill, and he didn't even know that this type of assistance existed, then it wouldn't be going to the people that can help, that it's supposed to help. So I think at the local level, they might understand better how to get to those who need the help most. I've seen in many websites, both in the United States and abroad, where it's not as clear. For example, click here for assistance. We work with DC Water. I think their website makes it very clear, like right up front, if you need financial assistance or whatever, this is how you get it. But once again, I go back to, can you access that from your phone? Are you providing information in a different way? Perhaps, by sending a letter and saying you are eligible for this type of assistance. So there's both things that you need, right? If you want to actually get it to the right people, you have to make sure that they know about it, because often they do not know that there are ways to get help in order to get back into the system. But what Director Daniel's talking about is the fact that if you continue to put Band-Aids on a sore, and you're not doing everything else that you might need, for example, antibiotics and everything like that, it's going to get larger and larger, and it gets out of control. And it gets to the point that you think that it would have been cheaper to push off all of your infrastructure, and what's happening is it's crumbling at your feet, and then it's going to be costing a heck of a lot more. So you need certain both local and federal levels of governance that actually incentivize the building of the infrastructure that is necessary to keep the access for everyone, the poor, the rich, the middle class, or whatever, just all of the customers from a particular area.
Well, fantastic. Yes, thank you both so much. Those are very, very interesting interventions, and I think it really highlights some of the challenges that utilities are facing, and some of the questions that need to be had, some of the debates and conversations that need to be had in communities today. So thank you both very much. What I'd like to do now is I'd like to introduce the next panel. And it's primarily a community action organization. So I'm going to introduce the panel, and then I am going to turn over to my colleague, Alexandra, to moderate that panel. So the speakers on that panel are Hester Brown, the president and CEO, and Gail Connor of the Capital Area Partnership Uplifting People. So Hester Brown and Gail Connor. And Capital Area Partnership Uplifting People is a nonprofit community action agency that was established under the Economic Opportunity Act of 1964 that serves Richmond, Virginia. We also have Monica Lewis Patrick, who is the president and CEO of We the People of Detroit, which is a nonprofit dedicated to community coalition building and to the provision of resources that inform, train, and mobilize the citizens of Detroit and beyond to improve their quality of life. And last, and certainly not least, is Mona Jacobs, the Chief Operating Officer of Project Bravo, which is a nonprofit community action agency serving the people of El Paso, Texas. So we're going to make sure that that panel is spotlighted for you, and Alexander will be taking that over in just a second.
And good afternoon. It is such a pleasure to have the four of you here. I can't highlight enough for participants today how instrumental these four women were to getting access and being able to reach out to households in each of these communities. So a huge round of applause to them and a huge thank you to them, because they were just incredibly instrumental in that. So thank you first and foremost. And we'll just dive right in. So the first question that I have is, what are 3 things that communities could do to help low-income households not have their water services shut off? And we'll start with Mona.
Hi, thank you everyone, and thank you for having me on this call. I think just speaking from based off of what we do here in El Paso, one of the strategies in terms of ensuring that households are not losing access to water services is making sure that we're leveraging support services from community partners across El Paso County or whatever community that you're serving. I think oftentimes, and we saw this especially throughout the pandemic, is that there are multiple nonprofit organizations, community-based organizations that are doing very similar work, but aren't communicating with one another. So for example, it was in the report that here in El Paso, there is an organization called Project Amistad, and they provide water rate payment assistance for individuals who are 65 and older. At Project Bravo, we were providing services to households regardless of any age limitations. However, they did have to be under a certain income guideline. So making sure that we're having those connections with organizations like Project Amistad to ensure that, you know, they're tackling the issue with clients who may be 65 and older, and then we're able to assist the other side of the population that needs the help. I think another strategy right here is to ensure that we're looking at the family as a whole and their issues as a whole. I think it was in the first panel where it was discussed that you know, having federal programs like the LIWAP program, for example, water utility payments is just one part of the issue, and we need to address the entire household. So is there food on the table? Are they able to pay their other utilities? Are they able to afford fuel for their vehicles to go to work? So I think that we have to stop looking at these issues as these isolated challenges and barriers for families, and look at it through the whole family approach as to how we can support and empower a more sustainable solution for our families.
Great, thank you, Mona. Monica.
Yes, I think for us, it's been a couple of things. One is really trying to battle this very racist narrative that somehow poor folks get up in the morning and just decide to stop paying their bills. And without giving the historical context to how we got here, we've seen massive divestment from the federal government for over the last 40 years. So without talking about that divestment, from 1977, the federal government was contributing about 67 to 69% of the dollars that went into infrastructure development and maintenance. And they're now only contributing a dismal 7 to 9%. Well, that burden has now shifted to the states and to the individual utilities, and therefore they have shifted it on to the backs of the individual ratepayers. And some of what we've had to battle in Detroit is just battling this very racist narrative around urban centers, mostly Black and brown and poor folks, not paying their fair share. When what we know in Detroit built an infrastructure that is providing water to 40% of the population of the state of Michigan. So when you don't put it in context to that, it seems like we've been derelict in our duties, when the real truth is we still are left with the legacy debt of building that infrastructure. And then the other external partners that are participating in leasing from that system, they're only contributing a partial amount of the payment to a $50 million leasing fee. Detroit is actually sharecropping from its own system. So when you don't put that into context, then it makes it very difficult to move the conversation beyond the politicization of it and the racialization of it, much as what we've seen play out in Michigan and throughout the Great Lakes.
So one of the themes that I'm already seeing come through is context and the full picture. That there's a full picture. There's a full picture of a family. There's a full picture of a community. There's a history. There are systemic issues that we're facing. And so if we lose sight of that, we're not going to be able to address these challenges, at least holistically. So that's another phrase that I'm hearing from both of you as well, is holistic, right? We need to think about the family, the holistic needs and holistic challenges of the family, and then the holistic picture of the city as well, and as that holistic picture.
Well, and holistically, but also deconstructing the racialization of it. Because if that's not deconstructed, then it becomes the justification for turning water off. Because even as you heard the sensitivity in Director Daniel's voice in terms of not wanting to increase those rates. Well, we don't always hear that sensitivity. Many times what we hear from utilities is the justification for having to shut water off and being very okay with that because they have been built up into this belief that there is no other alternative. We know there are other options because we've been a part of the different formations of creating those alternatives.
Absolutely. Hester, Gail.
So good afternoon. I definitely agree with the other two panelists. In fact, Monica kind of took the words right out of my mouth. We do have to look at the whole picture. We need to know why individuals aren't able to pay the bill and what are going to be the effects of turning the water off. That doesn't solve the problem. It adds to the problem. It causes additional concerns, both health-wise and socially. And so we need to look at other avenues for addressing this. I definitely agree with the second speaker is that we don't wake up in the morning and decide, well, I don't want to pay my water bill. That's not how it works. We can't afford to pay the water bill. So what are the reasons why we can't afford? Is it because the water bill is too high? Is it because we don't have enough income coming in to cover the costs? Are there other issues going on? It's not just simple as turning off the water and that solves the problem.
Right. Gail, anything to add?
I think a good tool in the survey that you created really nailed it when the section that covered what order you'll pay your bills in. Water was not at the top of that list because they're more thinking of roof over my head. And one thing that I wouldn't have thought of was pay your car note at the top. But several of them were like, if I can't get to work, none of this gets paid. So I think how it's the water bill that sometimes, like Hester and Monica have said, it's not you wake up in the morning to say, they prioritize. This is not like I'm not paying. It's like, I've got to pay this first. Right. So it's the prioritization.
Yeah, and the survey, actually, I was surprised at some of the results because we asked the question, not only as Gail said, how would you prioritize these different expenses? So car payment, health insurance, electricity, internet, and then we asked why. Because it's not just how you, but it's why do you make those decisions, which is what Hester was saying. Why are you, what are you facing? And we also asked the question, if you could pay some bills that month, why were you able to pay some and not all? And you start to, there's a really complex picture behind what these households are facing is considerable. And you see responses like, I have to keep ahead. I have to keep a house, a roof over the, my children's head. I can't have water if I don't have a house, right? Like some of them are very practical, right? Which makes sense. If you're receiving water through a tap, you have to have a house. So I'm delighted to hear, and I, even for myself, being able to have that picture and being able to talk about that picture, because I think exactly what Monica and Hester both said as well. People don't understand, right? You don't just get up and say, oh, I just don't feel like paying this. It's that you can't. And there's some really critical reasons as to why. And if we understand that, we can start to shape some solutions to that as well, which really gets me into the second question, or leads me to the second question. If we were to, some of the states and some of the utilities have designed rate assistance programs, but if we were to kind of redesign or even reconceptualize how we provide assistance and how we support families who are unable to pay water and wastewater bills, or even from Mona's perspective, how they can pay everything, right? If we were even to take on that monumental task, what would be some of the things that you would seek to include or consider in that? And I'll start in the opposite way. I'll start with Gail or Hester.
I'll defer to you, Hester.
Okay. Well, I think one of the things that we need to consider in working with redesigning the system is looking at how the system has failed in the past. If you don't recognize what you've done wrong, you can't start to correct it. So we need to take a look at what has failed in the past and listen to those surveys, listen to those individuals that have found themselves in those situations, listen to those individuals who are not found themselves in those situations, and try to figure out how do we go backwards? How do we fix this? How do we make this a better system? Is it necessary to turn off the water? Because that doesn't improve anything. It doesn't change anything. It just makes the matter worse. So getting people to understand, one, that the system needs to be redesigned, and then two, coming together to figure out how to do this.
Great. Gail.
I agree with that, because the way it's working now is not working. I was very surprised once I started working, assisting Dora with the water bills and the electric bills, at just how many people get their water turned off. So clearly it's not working. And another issue that we need to look at is, I've seen so many people who were not, I don't know if accustomed is the right word, to seeking assistance for a shut-off water bill until the pandemic and their finances changed. And a lot of their bills got to the point of no return because they didn't know where to turn. So help addressing that. People who aren't normally accessing assistance, they will then, if you have a way to reach out to them, then these bills might not get to the point of no return.
Yeah, it's a great point. If we can be more proactive about it, we might be able to stop some of this from happening from the get-go. I think that's a great point. Monica.
Yeah, thank you so much, both to both of the previous comments about this. It's just critical. I think there are two things that come up for us in terms of what we've learned in Detroit, is that the water department has made a decision that once a person is cut off from water, it's no longer their problem. It's not their issue. And so because they're not viewing themselves as a critical part of this ecosystem called community, then it makes it very difficult, along with not being transparent about shutoffs and restorations. But if they consider that person, and this is the term they've used in Detroit, no longer their customer, then if they're no longer their customer, they're still our community members and still our concern. And so much of our work has been around having to evidence the trauma and the public health impacts that actually ensue when you don't have water access. Part of that research was done in 2015, 2016. We had to collaborate with Henry Ford Health Systems and the Global Health Initiative and actually get the hospital to utilize its emergency data, over 37,000 cases. And they were able to use our water shutoff data, and through a comparative analysis, that demonstrated that even if you live on a block where one person doesn't have water, it increases the probability of you contracting a waterborne disease by 1.5 times. That was citizen science pushing public health entities to admit that there is a tie bar to public health issues and impacts and disease when there's not proper water and sanitation. It was community efforts that had to tell very debasing and dehumanizing stories of getting rid of their menstrual cycle material and fecal matter in abandoned buildings because they could not afford the plumbing repairs in their homes. And this was driving up the cost. And then, just as Sister Gail spoke to so eloquently, the digital divide, not only in our communities, but in our nation, is real. In Detroit, over 50% of the population does not have constant access to the internet in a way that's sustainable and accessible. So even grassroots community groups had to come together and cobble our dollars to get internet in place, to get laptops purchased, just to have 2 locations where people could go file for their unemployment and to make an appeal to keep their water on. So these are the things that we're navigating, even as we're having to plead with our federal government, our state and local governments, and our political officials that water is a human right, that there are ways to improve the accessibility and affordability of it. What is missing is the political will to do so.
Great. And again, all this is again highlighting the links between all of this, that as a community, we are linked. So I may have access to water, but if you don't have access to water, we are all in the same boat and we're all being impacted by it. And it's easy to forget that, but it's critical to remember, especially for driving this change, for driving the conversation. Mona.
Yes, no, I completely agree with the rest of the panel. I think, even looking at existing programs, so the LIWAP program, for example, and I know that this is true for the state of Texas, where the premise of the program is to ensure that families are connected, that they're not disconnected from their water services. But at the same time, there are certain barriers written within the programs themselves and the funding that create barriers that put them in the same place where they began with. So for example, with the LIWAP program, we're not permitted to pay non-water related fees, which, I was just reviewing a couple water bills before this call, and that can range anywhere between $15 to $20 and possibly more than that. And when we think of, for example, in El Paso, where the average person is getting paid under $15, $13, that $15 fee is the lifeline that gets that individual to and from work. That's someone's meal for the week. And I think one of the things that we need to reconsider, and this goes along the lines of redesigning, and I would even challenge us even further of just abolishing everything that's there and creating an entirely new system, is what the dollar means to our families. I think one of my favorite parts about this presentation is the qualitative aspect that you all have included. And one of the things I advocate for a lot is hearing from our families, hearing from the people that are impacted by this day in and day out. When we think about what the dollar bill means to our families, it's not what it means to the legislators that come up with these policies, to the water providers that are shutting off the services. We really need to reconsider, in El Paso, over 20% of families in El Paso live in poverty. And that's 7% over the national average and 6% over the state average. Oftentimes, El Paso, because it's a binational city, we're right at the border, we see very unique situations and barriers that our families experience. And I think that there's a huge disconnect between the people in power making these decisions and the people who are actually facing, these barriers every single day. So I think definitely ensuring that there's a seat at the table anytime that we're making these decisions, because, $15 and us not being able to pay that, still that family is disconnected. So there's a disconnect between what we're saying we're trying to do and what we're actually doing.
Yeah, so two things I want to highlight is that one is the disrupt. Right. So this idea of abolishing the system that we have, I think, is a great starting point, in large part because these conversations are difficult from all angles. These are not easy. These are incredibly nuanced. They're very complicated, and it's difficult when you're ingrained in a system that already exists. So by saying, look, let's just throw out what we have, blue sky thinking, let's start from that point. That, I think, is the kind of thinking that will get us to a new point. And so I really encourage all of us to take on that attitude and say, look, it's time to abolish the current way of thinking. It's time to say, okay, these are the very real challenges households are facing. Make sure that their voices are heard, make sure that their perspective is actually being gathered and understood. And that if it's not just gathered, that they're in the room, that they're part of the conversations, right? Maybe they can't be part of the conversations, but that's why it's so critical to reach out and have that line of communication with them. And so too, I want to end on that note and thank you for everything that you did in terms of enabling us to get access to households, to speak to households and lift up their voices, and for us to hear your stories and your engagement with these community members as well. So thank you so very much for everything you do for your community and everything you do for the sector, because without you, there's going to be a lot of people that wouldn't be getting access to water and all the other utility and all the other services that you provide. So thank you. Thank you for that. We're going to be moving into a 15-minute Q&A section, so please stick around and we'll have Director Daniel joining us. My colleague Luke is going to step back in and moderate that, so we'll just switch over now. So if while we're switching over during that time, I've seen some questions come up in the chat and in the Q&A. So as you're thinking, participants, please put forward your questions and any comments that you have in the Q&A or the chat box, and we will get to them. So give us 1 second.
Great. Well, thank you so much. Those were very, very powerful presentations. And I think already we're starting to hear about some of the conversations that communities need to have to try and think through how to revisit and review and change the system to make sure that there's the money that's needed and that the system as it exists is not contributing to continued systemic issues, systemic racism, and really thinking about how to address those questions. Now, one of the questions that I saw, which actually has stuck with me, that came in a little bit earlier during some of the presentations, was about homelessness. And I know that a lot of the questions that we're focusing on are really looking at households which have bills, which have water and pipes built into those homes. But I was wondering if any of you would be willing to speak to how you address homelessness when it comes to water service. And I guess maybe it'd be a good place to start with Director Daniel to see if there's any specific things that Shreveport is doing before sort of getting into how community organizations are also addressing this question. So Director Daniel, homelessness, how is it being addressed?
I don't address that directly. We have an Office of Community Development that works with the homeless community, to try to create a more palatable living conditions for them. So that's something that's sort of out of my sphere of influence.
Okay. Do any of the Hester or Mona or Monica or Gail, do you have a perspective on this? Gail, I don't know if I was.
I apologize. I'm wearing two hats right now, so I didn't even hear the question.
Well, it's about homelessness. So are there, what are the efforts being made to make sure that that people who are homeless are still getting their access to water?
Our agency or our city, we do have shelters that it's not even a city, it's agencies that have shelters where it's citizens can come and shower and do things like, and take care of their personal hygiene, but it's not all the time. Mm-hmm. It's not enough. And one of them for sure is located not very conveniently to people who do not have transportation. So as far as homelessness and access to water, that's it.
Okay.
And that's sad.
Okay. Well, and another question that came from our participants suggested, what about rounding up payments on bills or including the ability to donate to increase a fund that can be used to pay for rate assistance. I guess again, I'll start with Director Daniel. Is this something that has been tried? You know, the idea of encouraging donations or rounding up a payment, rounding up a bill to the nearest dollar to try to start generating some of these. And I know you were talking about the rates already being very high. So is there, or maybe has there been any discussion about trying to build donations into this? And then and I guess, is that even the right way to be thinking about this?
Well, I don't want to, if anybody wants to give, I certainly would never want to preclude their having an opportunity to contribute. We have never done anything like that here that I'm aware of. It could have happened previous to me. I know I've worked, well, let me see. I've received utility bills where they've asked me to donate up, and on occasions I do. But that is not a program that we have here. I don't know how successful it would be. I think there are better solutions than I certainly don't think you would be able to rely on that as the way you would help people. So again, like, I don't want to preclude that as it's just not one of the top ways that we try to help people.
Mona, Monica, Gail, or Hester, any ideas on that? Would donations be a way to try and, or rounding up bills be a way to try and address some of the shortfall that we're seeing, or provide some of that rate assistance?
I know for us here in Detroit, that has not been a workable plan. It's actually been a tool that's been used for PR purposes for the mayor and the water department than real solutions. I agree with Director Daniels. Of course, there should be no precluding anyone giving, but what we know is that charity is just that. It's based on the compelling someone to contribute. Whereas what we are in desperate need of is a sustained plan and policy for assuring that everyone has a pathway to afford clean, safe water and sanitation. And so I think if we don't make that difference, we find repeatedly across the country that somehow there must be some hidden playbook for water directors. If you're running low on water rates and can't increase those rates, then let's go to this B plan of putting forward this marketing strategy of charity. And I just think that it has been a failure in terms of creating that sustainability. And it also has been confusing in terms of advancing a plan of collaboration. Because it actually bifurcates the conversation, and then people get all geared up about a one-time campaign, and then we know that we're dealing with these issues 365 days of the year repetitively. So I agree with Director Daniels on his points.
Sure. Anyone else?
I just wanted to add as well that it was mentioned earlier that these rate assistance programs or donations to help families pay their water bills, it is truly just a Band-Aid. I think the key word here is sustainability. And if we have a family that comes in who owes 3+, 6+ months of utility payments or their rent or their mortgage payments, and we're able to apply this donation or do rate assistance to catch them up, the likelihood of them going back into that 3 months, 6 months of being behind is very high. So we're really just putting Band-Aids on Band-Aids and Band-Aids. And we mentioned this in the earlier panel that we need to rethink the way we support families, and that's redesigning the system, because donations and rate assistance only help so much until you run out, and then we're back in the same place. We help over 12,000 low-income households every year in El Paso, and we see the same families coming back to us every single year. So there's a larger problem besides paying a $35 bill to reconnect someone who might very well be disconnected in the next month.
Sure. Something that I know has been at the heart of a lot of discourse in the United States right now is the potential, or really the impact that inflation is having post-COVID on the ability of households and individuals to make their money stretch as far as it needs to go. I guess we're still in the initial stages, and I think there's always a hope that it won't get much worse. But has this already started to influence some of the thinking that you've seen among the communities that you work with? And I guess it's, also for Director Daniel, in terms of maintenance and sort of thinking about the cost that the utility is going to have to bear in the future and where that money is going to come from. Have these inflationary worries or pressures started to influence the way that you're thinking about how to approach some of these costs and rates and the potential for rates to go up? So I guess I'll start with, I don't know if anyone from the community organizations would like to speak to this first. I mean, I may have already set it up, inflation costs are going up. The money isn't necessarily going to be there. But I don't know if you're hearing anything from the people you serve specifically on this.
We are starting to hear that. We are starting to hear that clients on like SSI who get on a fixed income. So it's not COVID where my hours were cut or I lost my job completely. This is the same income I've had all the way through. But now it's not stretching far enough because everything has increased. And when you're on a fixed income and the water bill still needs to be paid, the electric bill still needs to be paid, but a loaf of bread costs almost twice as much as it did a few months ago, then you're going to have that disconnect of paying your water bill, buying food, my medicine. I'm seeing it sporadically now. And within the net by June, it's going to be the majority of our clients, unless things go down, which I don't see it happening.
And I'd like to mention that this is just not the individuals who are not working. These increases with the inflation is going to affect those working individuals as well. So that's going to add to those individuals that are unable to pay their bills. And while there are organizations like Capital Area Partnership out here trying to help, it does not increase the funding that we get to provide that help.
That's right.
So inflation does nothing towards that funding. So that means that we're able to serve less people because there are more people in need.
And not only that, not with our program, but some places where people will be seeking assistance, the guidelines will not have changed as far as income guidelines, not really putting into consideration how much more things cost now, where that income isn't stretching where it did before, when you're paying double what you were paying for gas, but those income guidelines aren't going to change.
And I will say this, we're worried about the water department being able to pay their bills with the inflation. Our pipe and our materials to make water are escalating so rapidly. Our budget is already wrecked for the year. We have to, in government, we have to buy yearly. We have to advertise for yearly contracts on chemicals and pipe and things like that. And right now, because of the inflationary pressures, these companies are afraid that if they don't really aggressively escalate their prices out into the future, they may get caught not being able to have enough money, not being paid enough for what they're supplying. So it's the inflation is it's wreaking havoc at almost every level.
Well, I think it's something that obviously exacerbates a lot of the problems that we're seeing and that we're facing. So thank you all. We're moving on to our closing remarks now, and so I thank you all for your comments, and certainly I hope that as questions come in from people who've attended, that these questions can continue to be part of how the AWAS can evolve and grow over the coming years. So thank you for those and for those insights and thoughts. So I would like to now take the moment to introduce the Special Rapporteur, the United Nations Special Rapporteur on the human rights to safe drinking water and sanitation, who was appointed by the Human Rights Council in 2020, Mr. Pedro Arrojo Agudo. And I would like to thank him for being here. He has already established himself in just a few short years that he has been the special rapporteur as a leading international voice on water service equity. And we are very, very grateful to have him here today to provide some final and closing remarks on some of the issues that are facing the world going forward. So, Mr. Special Rapporteur, I turn it over to you.
Thank you very much. Thank you for your invitation and for your attention, of course. As you know, I was appointed UN Special Rapporteur barely a year ago. My first report to the Human Rights Council in Geneva was focused on what I call the global water crisis on the water planet, the blue planet, with those 2 billion people without guaranteed access to safe drinking water. People who, in the majority, are not properly thirsty people without water in their living environment, but impoverished people who have difficulty paying and who, in many cases, only have access to water from polluted rivers, lakes, or aquifers. Therefore, the main roots, from my point of view, of this global crisis lie in the confluence of 2 structural flaws in our way of life and development. The flow of inequity and poverty that we have generated from profoundly unjust and immoral socioeconomic systems, and the flow of unsustainability that we have provoked in our aquatic ecosystems, turning water from being the key factor of life into the most terrible vector of disease and death that humanity has ever known. On the basis of this diagnosis, from my point of view, there are 2 axes on which to focus our efforts. Making peace with our rivers, wetlands, lakes, and aquifers, and promoting democratic governance.
Welcome to Verizon Wireless. Your call could
human
not be
rights-based
dialed.
approach.
Please check the number and dial again. Announce.
Recently, I have published a triple report on climate change and human rights to safe drinking water and sanitation, in which I insist on promoting the hydrological transition as the axis of adaptation strategies, just as the energy transition presides over mitigation strategies. A hydrological transition that must strengthen, on the one hand, environmental resilience, recovering the good state of aquatic ecosystem, especially wetlands and aquifers, which are the most inertial parts of the water cycle in islands and continents, and on the other hand, social resilience with adequate hydrological, territorial, and urban planning from approaches based on human rights. Well, these are the reference from which I will give some contributions entering into the issue of affordability of water and sanitation services in the current climate change outlook in general, and most particularly in the USA. Well, I must warn and acknowledge that I am by no means an expert on the situation of these services in the USA. You know much better than me, of course. Therefore, I will only give a few references obtained from relevant studies on the subject that conclude that water bills are, as you said before, increasingly unaffordable for many people in the US and other countries for a variety of reasons, adding urban infrastructure, climate crisis and adaptation costs, federal budget constraints, and growing income inequality, and others. Well, a study published in 2017 in the journal PLOS ONE found that water bills were unaffordable for 12% of households. And if water rates rise at projected amounts over the next 5 years, it will be almost 36%, is a lot. A 2019 study published by the American Water Works Association found that low-income households spend around 10% of their income on water bills, with international standard, as you know, for affordability being around 3%. A 2020 analysis of 12 cities in the US published in The Guardian shows that the price of water and sewerage services increased by 80% around on average between 2010 and 2018. And finally, according to Food and Water Watch, in a typical year, an estimated 15 million people in the US are cut off from water because they cannot pay their water bills. Well, I do not intend to go into detail about these data and estimates, but simply to outline that clearly seems to be a reality. On the one hand, the difficulties of a very important percentage of poor families in paying for water and sanitation services with the corresponding risks for their human rights. And on the other hand, the prospect that these risks will skyrocket in the current perspectives of climate change due to tariff increases. In this context, I am in particularly concerned and not just thinking on the US about privatization pressures, trade water markets, and the recent entry of water in future markets. With the first question, although only 10% of people in the US receive water from private companies, it is important to note that these companies on average charge households 59% more than local governments about this for the same service, and that they increasingly pressure families with payment difficulties. On the other hand, as I explained to the UN General Assembly in my report last year, I'm concerned about the evolution of the trade water right markets in the United States, as in other countries such as my own, Spain. And I'm especially concerned with the leap that is taking place as Californian water is traded on Wall Street future markets. Well, the fact that these future markets are dominated by large banks and institutional investors since the financial deregulation of the late 20th century augurs dangerous and perverse speculative games on scarcity, on water scarcity in the current climate change perspectives that can trigger urban raids. From my point of view, it is not acceptable that speculative strategies can trigger urban water raids, as happened, in fact, with basic foods in 2008, putting at risk or breaking the human rights of the most impoverished due to unaffordability of these services. The prevention of scarcity problems derived from the droughts must be done from an adequate hydrological, territorial, and urban planning, open to citizen participation and based on the precautionary principle and human rights. And not from, of course, from my point of view at least, and not from speculative strategies as a simple business space for large banks and institutional investors. Cities, from my point of view, must become actively involved in the preservation of the ecosystems from which they draw their water supply, and very particularly in the protection of their strategic reserves, an issue in which aquifers can and must play a fundamental role, and also to adopt a responsible attitude towards these ecosystems with adequate sanitation for their discharges. And with regard to increasing flood risks, plans for the adaptation of urban drainage systems should be promoted through strategies for the permeabilization of urban surfaces when the geology of the subsoil allows it, and the progressive promotion of a storm drainage network separate from domestic and industrial drainage. Introducing, from my point of view, introducing specific taxes in proportion to the permeable urban area for which each one is responsible could help to encourage good and responsible urban practices, and at the same time contributes to financing this urban adaptation to climate change. In my recommendations to all governments, I insist on the need for explicit recognition of the human rights to safe drinking water and sanitation in national legislation with the consequent obligations. This should entail the prohibition of water cutoffs for families and individuals in situations of poverty and vulnerability, as well as the establishment of a guaranteed vital minimum that ensures the fulfillment of these human rights. On the other hand, I encourage local and regional authorities with effective competencies in the management of these services to act in this regard if their respective governments do not do so at the national level. And finally, let me propose a reflection on the lessons of the pandemic. By laying bare our vulnerability, regardless of social conditions or national borders, we are now beginning to understand the motto, leave no one behind. Not as a voluntarist slogan, but as an inescapable necessity. Consensus is growing worldwide on the need to strengthen our public health systems, including water and sanitation services as the cornerstone of public health. And in this context, it is no longer worth arguing about the financial gap, as in 2008, when we were forced to accept austerity strategies. Today, we have faced the pandemic with substantial public funds, and important public funds are at present available for socioeconomic revival with the so-called Green New Deal of the 21st century. If we understand that we are facing a democratic challenge in terms of public health, water and sanitation, the question we should ask ourselves is whether we are really willing to dedicate a significant part of these public funds to finance this challenge through specific lines of funding to local and even community institutions in many countries to accelerate the achievement of the SDG 6. But I insist, we can only achieve this if we understand that we face a challenge, this challenge as a democratic challenge and not as a business opportunity. Thank you very much, and I remain at your disposal from right now and at the disposal of your communities in any way I can be useful. Thank you very much.
Thank you so much, Special Rapporteur. Powerful words, in large part because you, as so many of our speakers did, highlighted the significant complexity of this issue, the multiple threats to water, the multiple challenges that we face, and really two themes they've continued to come through and shine through as the conversation has continued. One is that there's this very comprehensive picture of what it takes to ensure that everybody has access to water, from protecting our water resources to combating flooding, to addressing the droughts, to not trading our water on financial systems, to recognizing that this is a public good that we should all have access to, that we need access to. And the second is the desperate need for citizen participation and democratic engagement. These are our water resources. This is our water. And it is critical that we are informed and we are engaged and we have the data and information and the tools in our hands to be able to act on this and to ensure that we're demanding that we have access to water. And so thank you again for highlighting those themes that are so critical to ensuring access to water for everyone. So thank you, Special Rapporteur. Thank you, Congresswoman Dingell. Thank you, Director Daniel. Thank you, Michelle. Thank you, Hester, Gail, Monica, Mona. Thank you for all of your words, your inspiring words. If these are the rock stars of this community, and I don't use that term lightly, these truly are the rock stars of this community who are out there on a daily basis fighting for each of us to have protected water, to ensure that tomorrow we have access to that water, that the water that we drink is safe, that we can feed our children, that we have the home and the livelihood that we want, and that we have the earth that we want. And so thank you for reminding us of what is at stake. And the theme of this work is it's time. it is 2022, and it's about time that each and every one of us have access to water. So with that, the American Water Access Survey is launched, and we hope that you will continue to engage with us on these issues, that you'll work with us, that you'll partner with us, that you'll seek out and engage your elected officials, that you'll engage your utilities, you'll engage your community members, and you will engage on these issues, because without you, we will not have water in the future. So thank you to all of our wonderful speakers. Thank you to our participants, and we look forward to hearing from you soon and engaging with you directly. Thank you, and have a wonderful rest of your day.